our costs out of control? Some people suggest it's technology. Some people suggest it's demographics. I happen to believe that overwhelmingly it's the third-party pay system. And I'd like to illustrate to you why, and I think most economists would agree with this. When a third party pays for a service or product, we consume it as if it were free. We never ask what the price is, and we overconsume because we consume it as if it were free. When's the last time you asked your doctor what it was going to cost? When's the last time you actually shopped before you consumed health care? Like you shop before you consume other things. When's the last time you asked the hospital what it was going to cost? We don't do that. And by the way, the healthcare system's not set up to provide that kind of information. And the reason they aren't set up to provide that kind of information is because we don't demand that kind of information. Suppliers do provide what we demand, and we don't demand that. It's interesting if you would think about if employers, rather than providing health insurance, provided food insurance. So every time you go to the grocery store, you just take out your food insurance card, you give it to the cashier, and she scans it, and you're out of there. Pretty soon, you would start buying caviar, the most expensive steak, and you would start buying more than you needed. Also, pretty soon, the supermarket would discover that you really didn't care about price. So the supermarket would remove price because it really doesn't affect your decision about what to buy and what not to buy. And if I'm the supermarket operator, I'm going to raise the price because you don't care what the price is. And guess what happens? Then all of a sudden, the employer has estimated you're going to spend X dollars a month. You're spending X times 1.1, X times 1.2, X times 2, X times 3. And that employer is going to say to the insurance company, you've got to get this under control. So the insurance company is then going to tell you, you can't buy caviar but once a month. Then you're going to come back and say, that's very unfair, you insurance company. You're a bad person, or you're a bad entity. And then the insurance company is going to tell you, because it's responding to the employer, you can only go to X supermarket, not Y supermarket. And you will have the same dynamic in the food, in the grocery business as you do today in the healthcare business. It will be broken. For the uninsurable, they're going to need to be handled separately. When you have, what you're basically doing is insuring a house that's already on fire, and you can't expect an insurance company to step up to that. If they're forced to, then they've got to raise rates on everyone else. My suggestion is, and I'm sure we'll explore it more, is that the uninsurable, the people with chronic illnesses, predictably high costs, need access to insurance. And the question is, how should that be handled? And I think it should be handled outside the conventional insurance system. And then, there's the uninsured, the people who cannot afford it. And that's why Senator McCain has proposed, which is similar to what Karen pointed out, that President Bush proposed, a tax credit, a $5,000 tax credit to make insurance affordable for people to buy family coverage. And what he's also proposed is additional funding to the states to provide additional monies for those who can't, for whom that $5,000 is not adequate.
If it were easy to sit down and say, we have a white piece of paper, this is the system that would work for the United States, the problem would have been solved a long time ago. The problem is we don't have a system that anyone ever sat down and designed. Why do we have employer-based coverage? We have employer-based coverage because during World War II there were wage and price controls, and employers wanted to give people raises, and they gave them benefits of health insurance instead of wages to keep employers at a time when the labor market was tight. No one sat down and said, let's make a health care policy. The current system, because of the kind of atomized way it was created, has terrible information sharing and terrible access to the data that you need to make market decisions and that you need to make good healthcare decisions. We haven't invested as a country in the kinds of technology that would make it possible to go to a doctor in one city and then a doctor in another city and pull up your medical records so you don't have to do the whole workup all over again. I mean, how many of us have been through the same screening procedures when we know the results because we just did it, but they have no way of accessing the records?
When I was looking at statistics about healthcare spending, I was really struck by one figure, which is that almost half of healthcare spending is used to treat 5% of the population. I mean, these are obviously our oldest people, our sickest people, people at the end of life. Jack, you had said that, if you were given accurate information and were to discover that, there's only a 10% of a chance that a specific procedure would be effective in treating your condition. I think in these kinds of circumstances, you know, if it's my kid and there's a 10% chance, I'm going to shoot for the 10% chance. Getting a control of healthcare costs, I mean, isn't it eventually going to have to involve some kind of, if not rationing, some kind of power of just telling people no?
You know, I hope it doesn't come to that. I don't think it has to come to that. And I think that the example you give, it's obviously the most painful kind of issue to think about. What decision do you make for a child? The more typical decision is what kind of decision do you help a parent make? And you know, it's not free to make a decision to pursue the heroic means. It has a lot of implications for the quality of life at the end of life. You know, we have a system where people should be free to make those decisions. And we also ought to have a healthcare system where people get information where it's not coming in the small slices that it comes now. If you have cancer and you see an oncologist, the oncologist gives you advice about how to kill the cancer cells. The oncologist doesn't often tell you that the result of the most aggressive treatment may leave you with a quality of life that you wouldn't have chosen. So I'm not saying people should be told they can't pursue heroic means. And I'm not saying that I wouldn't pursue heroic means if I thought the outcome would justify it. But I think there are a lot of cases where heroic decisions are made where if people knew what they were choosing, they might not have made that choice. You don't want to undermine the research in the drug industry that is producing the breakthroughs, which will make the problem you describe worse. Now, drugs are about 10% of the healthcare bill. It's going to grow as a percentage. Drugs and technology are growing while other things are faster than everything else. So it is a very real cost issue. You know, I guess I think a few things. First of all, I think the advertising issue you make is one that it makes for good political fodder, but it's also a real issue. I mean, they spend more money on advertising than they do on research.